Due to the global outbreak of the coronavirus, the Voice of America is taking every necessary precaution to safeguard its employees, so our broadcast will look a little different today and in the near future as we reduce our staffing at VOA headquarters here in Washington. We appreciate your staying with us on Straight Talk Africa. Hello, you are welcome to Straight Talk Africa. And today on Straight Talk Africa, we explore the impact of the coronavirus pandemic on the refugees on the African continent. Refugees are among the most vulnerable people in the world. They are often forced to live in densely populated spaces and lack access to clean drinking water or soap. To help us understand the challenges faced by refugees and humanitarian workers trying to reach them, VOA's Salem Solomon has the story.
Sick or healthy, young or old, 1% of the global population have been pushed out of a place they call home in search of a safe haven. About 80 million people in the world today have sought refuge or have been internally displaced, according to the United Nations. And this flow of refugees isn't slowing down. 10 million of them found themselves in this predicament in the last year alone.
We pledge to do everything in our power to end the conflict and persecution that drive these appalling numbers.
Millions have a second layer of vulnerability added this year due to a global pandemic that spreads quickly among people who live in close proximity to one another.
And many of them live in very crowded settlements, either in formal refugee camps or informal settlements, where there is very limited access to water, for one, but all of the kinds of precautions that we're reading about as best practice in terms of avoiding contamination, self-isolation, frequent hand washing, these are not necessarily always available.
The outbreak is also preventing humanitarian workers from reaching vulnerable populations. Borders are closed and international travel has slowed to nearly a standstill.
We really are hamstrung ourselves. We're stuck at home, we're stuck in airports, we have our things that we're intending to deliver, and this can be soap, it can be food, blankets, the sort of infrastructure associated with getting more water into facilities, pipes and pumps and all these sorts of things.
In West Africa, 50 million people are threatened by hunger due to conflict, climate change, and rising food prices. The humanitarian group Care West Africa says the coronavirus outbreak is exacerbating this dire situation and making it hard for aid workers to reach the most vulnerable people.
So these people, they live on humanitarian assistance or support from their host communities. Currently, with restrictions, humanitarian actors have limited access to this population. So there is a challenge for them to ensure their daily needs. So if nothing is done for such population, in the coming months, we will have, as said, more than 50 million of them in food insecurity and food crisis.
And even when aid workers do have access to the population, many are forbidden from congregating to receive aid.
And when we talk about humanitarian assistance, it implies many times gathering people for either food distribution or for sexual and reproductive health support, etc. So these activities cannot be undertaken as initially planned. It delays or it takes longer.
As countries restrict travel and close borders, those who work closest with refugees ask leaders to be compassionate and remember that not all people cross borders because they want to. For some, they have no other choice.
We always feel that people should have the right to seek a safer life, and there are justifiable reasons why people are crossing borders. But against that, there is also the reality that the movement of people in itself is a risk. Linked to how the virus spreads. The challenge is about ensuring that when responses are put in place by governments, many of these responses are completely understandable, but that they take into consideration the reasons why people are fleeing, and they consider and they continue to be imposed with sort of humanitarian principles in mind.
Even if refugees take much needed precautions against the coronavirus, they still remain vulnerable due to circumstances they can't control. Salam Solomon, VOA News, Washington.
Thanks very much, Salim, for that report. Joining us today to talk about how the COVID-19 pandemic impacts refugees are from Nairobi, Lucy Kiama, Country Director in Kenya of the Hebrew Immigrant Aid Society. From Washington, D.C., we are joined by Eskinder Negash, President and Chief Executive Officer of the United States Committee on Refugees and Immigrants. I have to say, Lucy and Eskinder, that I'm profoundly honored and exceedingly humbled to have the opportunity to host you on this special edition of Straight Talk Africa.
Thank you, Shaka. It's a privilege for us to join you also.
You're most welcome, sir.
Thank you, Shaka. It's an honor to be in this show.
The feeling is mutual, Lucy. Let's go to Nairobi because you happen to be the only one among us who is on the ground. How is the lockdown in Nairobi, Lucy?
Thank you, Shaka. In Nairobi, the lockdown continues, and it's not a full lockdown. It's really cessation of movement from Nairobi and to Nairobi because of preventing the spread of COVID from Nairobi to other counties in Kenya. It continues, and the cases that are confirmed positive continue to rise, and this is a bit worrying for all of us.
So how has the coronavirus pandemic affected your activities so far? Thank
you for that very good question. Hires in Kenya, we work in Nairobi, and we have a presence in about 9 locations within Nairobi. However, we cover different cities, about 6 of them within Kenya. That includes Nairobi, Mombasa, Nakuru, Meru, Kilifi, Malindi, and we work with urban refugees, but we also have a linkage to the camp refugees who are in Dadaab and Kakuma refugee camps. So how COVID has affected our work is that we were not able to continue working from our offices when the first case was announced in Kenya in mid-March. And we resorted to teleworking. And because we provide direct services to refugees, we had to change the mode of delivering our services. We now resorted to providing services using by calling our clients, by communicating through WhatsApp, by conducting meetings via Zoom and Skype, and that way most of the services that we had planned to deliver to the refugees in Nairobi and in other parts of the country, we continue to do so. What we suspended were the community-based activities, because we do organize community forums where we provide community counseling, community-based information to empower the refugees to know their rights and their obligations when they are in our country. And all that was suspended. The social gatherings were all suspended, and so that we can maintain some level of social distancing, and also as a way of preventing refugees from contracting the coronavirus, and also as a way of protecting our staff from also getting the disease. So that's how it majorly affected our work.
Let me come to you, Eskinder. Eskinder, how has the coronavirus pandemic affected your activities?
Thank you, Shaka. Our activities are impacted because the U.S. government decided to suspend the refugee program. As of May 31st, I think we had about 7,600 refugees and then about 8,000 what we call them special immigrant visa holders. These are Afghan and Iraqis. So overall, this is probably the lowest number of refugees to be admitted in the U.S. Since maybe 1975. According to UNHCR, there are about 10,000 refugees ready for departure, but given the coronavirus, their departure has been delayed. We have managed to bring some emergency cases to the U.S., but overall, the number is way down. This is the lowest number we have been resettling in this country. We used to average up to 90,000 refugees per year, but unfortunately for the past 3 years, we very much the first year of the administration, we had 45,000, and then they revised it to 30,000. And then now for FY 2020, they decided to have 18,000, but unfortunately so far we had only 7,600 refugees. So we're waiting. UNHCR and IOM recently announced they will be resuming flights, but again, it depends also whether the administration is willing to accept refugees or other refugee resettlement agencies. If I may just to add to what Lucy said in terms of Kenya, as you know, in Kenya, Shaka, there are about 320,000 refugees just in Dadaab camp alone. 320,000 refugees. And then, according to the report we have, there are about only 800 beds and then one ventilator. One ventilator for 320,000. So, given that a lot of NGOs actually close their office, so the crisis in refugee camp is yet to be told, and we don't really know how many people have been infected unless Lucy knows that number. So we are very worried. As you know, Africa is hosting a lot of refugees in poor condition. Ethiopia has close to 1 million refugees, again in a very poor camp condition. You have Sudan, a lot of refugees. In fact, a group of refugees in Sudan, they have been there since 1967, again in a very bad camp situation. So we see COVID, the virus, as a major threat to refugees and immigrants.
Now, Eskinder, pardon me for saying this, but I know that your group, the U.S. Committee to Protect Refugees and Immigrants, deals with the whole world. But what about if we were to focus specifically on Africa? How many refugees have you received this year from Africa?
Unfortunately, I don't have that number, but last year in FY 2019, I believe about 42% of all refugees came in are from Africa. So that's the highest number we had. Again, you have to look at the big picture, which is last year we only admitted 30,000, and this year that number is 7,600. So 7,600 out of 79.9 million refugees is just very much not significant, because according to UNHCR, as we speak, there are 30 million refugees and another 45 million internally displaced people. So, having 7,600 refugees, not only from Africa, for globally, that's a very small number. But unfortunately, I don't have the actual number for African who have been resettled in the U.S.
I see. Lucy, you said that you deal specifically with what you characterize as urban refugees. What exactly do you mean by that?
When we talk of urban refugees, we are speaking of refugees who reside in urban areas. And this is a bit different from the camp refugees, because those who live in the camps, especially in Kenya and most camps in Africa, they are entitled to assistance, which is free to them. And that way they're able to access most of the basic services, including food, shelter, access to water, sanitation, schools, and healthcare services. But for those who live in urban areas, they're expected to be able to sustain themselves. For example, in Kenya, we have about 78,000 registered refugees living in urban areas. And the policy in Kenya expects all refugees to live in the camps. However, naturally, with population, when there's overcrowding, some will start moving to other areas to look for greener pastures, to also be able to fend for themselves. But unfortunately, there are those who are very vulnerable. Some have very unique risks. For example, the unaccompanied children, women who are at risk of abuse, persons with disability, the elderly. So when they end up residing in the urban areas, the programming that is expected for them is a bit different from that in the rural in the camps, and that's why we refer them to as urban refugees, because we have to think of where they will live in mostly the low-income areas, how they can access jobs so that they can fend for themselves, the kind of human rights violations they encounter when they are in urban areas, and how they can be addressed, including arrest by police, extortion, and also gender-based violence in their homes, but also perpetrated by host communities and fellow refugees. So that's the main difference, that the programming focusing on urban refugees is a bit complex, and it focuses on needs that are very different from those in the camps.
Lucy, where do the refugees that you deal with, where do they specifically come from?
Most of the refugees who are in Kenya come from the neighboring countries, and most of them are displaced because of conflict. Others are displaced because of persecutions, because of their gender, because of their religion, and some because of belonging to a particular social group. And so when they come to Kenya, Kenya is very generous in hosting refugees. Our borders are open to them. And so most of the ones that we have come from Somalia, the largest number. Majority of a big number also comes from South Sudan. We have some from Ethiopia, from Eritrea, from Uganda, from DRC Congo, and you can tell majority of them are from the conflict-affected countries.
Now, how do some end up, for example, in Kakuma and Dadaab, and others end up in what we call urban areas, when in fact they come from the same countries? I say that largely because I know that you have a lot of Somali refugees in Dadaab and Kakuma.
Majority of the refugees, when they come to the country, if they're coming from Somalia, Ethiopia, Eritrea region, they will end up going to Dadaab refugee camps, because it is to the northeastern of the country, which is bordering these countries. However, and then those who come from South Sudan, Uganda, DRC Congo, they find themselves going to Kakuma refugee camps because it's nearer to the borders of these countries. However, as I said earlier, because of overcrowding in those refugee camps, some want not to look very dependent, and they want to fend for themselves. So they will migrate to urban areas. Majority of them are in Nairobi. And when they come to Nairobi, they will look for the locations where refugees are densely populated. And most of them will look for refugees who are from their nationality, because that way they are easier to integrate into the society. And also because these are people who speak the same language, they share the same cultural backgrounds, and it's easier for them to be guided by their own. So that's how they come to Nairobi, and those who are not able to fit in Nairobi, because Nairobi is the capital city and life is quite expensive, some find themselves moving to other cities like Nakuru, some to Mombasa, because life is cheaper there. Some will go to Eldoret, maybe on their way from Kakuma refugee camps to Nairobi, they might find Eldoret is a better place to live. And it's cheaper, people are friendly, and things are easier to navigate from those other cities.
Eskinder, what type of refugees do you deal with from Africa? I'm talking about what type of refugees that come from Africa that you end up dealing with.
Yeah.
Are they the type that have been characterized as the quote-unquote elite refugees?
Well, I think the kind of refugees we get, as Lucy mentioned, we get Somali refugees usually coming out of Kenya. We have Eritrean refugees coming out of Ethiopia. And Uganda also, as you know, Uganda has a very generous policy of out-of-camp program. We get them from Uganda. So it's depending on the location, we have a mix of refugee coming in, but dominantly Congolese refugees coming out of out of Uganda and the Rwanda, and then we have Somali refugees from Kenya, and we have Eritrean refugees coming from Ethiopia. But again, as I said before, the program has been suspended, and we don't really know when the State Department will open and start bringing refugees.
What about South Sudan and Sudan?
Well, South Sudan is also will be processed, but if they have to come, mostly they will be coming out of Kenya, because I think the South Sudanese camp in Kakuma, as Lucy mentioned, has been there for a long time, and I think I think UNHCR are a better handle of the Sudanese refugees in Kakuma. Yes, there are also South Sudanese in Ethiopia and the southern west area. But I think the number is very, very small, as I said before. Out of 30 million refugees, we ended up bringing 7,600. And that's really the lowest number in the history of refugee resettlement in this country, going back to 1975.
What are the forces or the drivers behind the refugee issue?
Well, as you know, the refugees are victims of either state persecution, because of their religion or political identity or ethnicity. So that's really the definition of refugees. They have a well-founded fear of persecution. They have, because of their political beliefs, ethnicity, association, political parties. So that's really how we define it to the most part. But we have also seen, refugees because of gender violence. In some places, they will be considered also. Again, just to remind Shaka, in the U.S., we have resettled close to 3.4 million refugees since 1980. And that's just a global number. It goes back to Vietnam, Cambodia, Laos, post-U.S. conflict areas, from Bosnia. So the U.S. has been very, very generous in terms of bringing refugees. The past 3 years is where our refugee resettlement suffered a great deal because of the policy we have. And I think that, as I said again, it's worth repeating, 7,600 refugees in FY 2020. And if we don't open the process soon, I am afraid that there will be the lowest arrival in the history of this program.
What about the number specifically from Africa?
The African number has never been always high, but because of the cut, we ended up actually getting significant number of refugees, mostly Congolese refugees from Rwanda that came into the U.S. Again, as I said, emergency cases are showing up, but that number is also very insignificant.
And once you get these refugees in the United States, What specific services do you provide them?
Good question. Just to give you a little bit of a background, the average refugees stay in refugee camp at least 17 years. And out of that, we pick a few number of refugees to come to the U.S. When they arrive to the U.S., they will be treated like any other, U.S. citizen, except that, they are not citizens of the U.S. So they get housing, they get food, employment, and education. All of that is provided to refugees. There are 9 resettlement agencies at the national level, and we are one of them. Lucy's organization, HIAS, also is another one. So we are responsible to provide the services, resettle them. We have close to 220 different locations in the U.S. USCRI, our agency alone, has about 36 locations where we do refugee resettlement. And since 1980, just our agency alone, we resettled over 350,000 refugees in the U.S. So there is, we have about 9 organizations at the national level, and they have their own branch office and partners around the country. So it's a very well-organized, well-managed program, and we've been doing this for a long time. USCRI, as you know, Shaka, has been around since 1911. Have provided service to refugees and immigrants since then, and will continue to do that.
What is the difference, Eskinder, between what you would call refugees and those that receive political asylum?
Well, from a U.S. perspective, there is no distinction. The political asylum recipients are people already here in the U.S. Once they get here, either they came as a tourist, or they came as a student, or they came for employment. So finally decide, because of the condition back home or their own cases, they decide to apply for political asylum. So they go through the court system. We have an immigration court in the U.S. Once a case is affirmatively decided, then they will be treated as refugees. Refugees are coming to the U.S. through a different process. It takes about 2 years, a little bit more in some places, because they have to go through security vetting, they have to go through medical screening. It takes a long time. They have to be interviewed by Homeland Security folks. Background check is done. So they have been fully vetted before they come. So as I said, they come from Kenya, they come from Ethiopia, from Uganda, and Rwanda, and other places around, from Turkey, from other places globally where the U.S. government processes refugees. So the distinction is, asylees are people who came here to the U.S. Through a variety of ways and decided to apply. Once they applied here and get affirmative decision, they will be treated like any other refugees, and they will be receiving the same benefit to the same extent as refugees.
As a matter of fact, in 1976, when I first came to the United States, I was under the political asylum classification.
That system still is around. Unfortunately, some policy has been changed in terms of the asylum policy under the current administration. It's much tighter, and that's really also a little bit of an impact. But usually, asylum seekers are already here, and Shaka, in your case, a lot of them came in, 1976, given what happened in Uganda at that time. And it's a lot of Ethiopian came that's the same period of time through Sudan. So it's just a reflection of what's going on back home, is where you see the growing refugees in the U.S.
Interesting. Lucy, what about you? What sort of services do you provide for those urban refugees?
We focus on protection and assistance of refugees, and we have a focus on 4 main programs which enable us to provide these services to the refugees. So the biggest program that we have is on mental health and psychosocial support. And here we work with the community and design programs that will help us to help them handle their ecological disturbances, their trauma, which they encountered when they in their country of origin, any other trauma they have encountered in our country, including gender-based violence. And once we have those programs, then we are able to provide counseling, we're able to provide group therapy for them, and that way they are able to settle down and be able to cope and move on with their lives when they are in Nairobi.
Time is not our best ally, and for that, we'll go for a break, and when we come back, we shall continue with the discussion. Don't go away, because we'll be right back with you.
Health, wellness, sport, beauty, medical breakthroughs. Healthy Living cares about your well-being. Every week, connect with our experts. You can ask them your questions and get their advice. Join me, Lina Mudu, in Washington on Healthy Living, your new health program, right here on Voice of America.
Welcome back to Straight Talk Africa. We are talking about the impact of the coronavirus pandemic on refugees. And my guests are from Nairobi, Lucy Kiama, Country Director in Kenya of the Hebrew Immigrant Aid Society. From Washington, D.C., we are joined by Eskinder Negash, President and Chief Executive Officer of the United States Committee on Refugees and Immigrants. Could you give us a sense as to what you characterize as gender-based violence?
Thank you. Gender-based violence it covers many forms of violence. We are talking of intimate partner violence. This mainly happens between partners or spouses, people who are intimate to each other, and mainly it may happen because the women who are in this kind of relationships may not have voices. They may not be empowered enough to make decisions, especially related to money and finances. And then we have men who use maybe their power and masculinity differently, and they end up violating their partners. Then we have violence, sexual violence. Mainly this is defilement, sexual violence taking place in the communities, some perpetrated by the refugees, others by even family members, and others by the law enforcement officers. And those people who undergo sexual violence, they require very specialized programming and so that they can be treated against contracting HIV/AIDS. They can be treated against, to address their mental challenges that come with that kind of trauma, so that they're able to confront the issue and to deal with it and to be able to cope with the situation and move on with their lives. And of course, there are injuries that go with sexual violence that also require treatment, and also prevention of other sexually transmitted infections. So when sexual violence takes place, then we have partners, and we work through partners because of the treatment, the medical treatment, but we also provide the counseling, and we also provide legal protection for them. Then we also have violence against women and girls that can be perpetrated either by family members or community members, or even by the institutions where they even go to work. We have workplace harassment and that takes place. So we are also classify this as part of gender-based violence. Then in Africa, there's a lot of early and forced marriages for children. We are seeing children below, even as young as 10 years even with this COVID, undergoing sexual violence. We have quite a number who are pregnant within those 3 months, and children really do not qualify to give consent for sex. So there is a lot of also that early sexual intercourse with the children, and early enforced marriages. That again we classify it within the gender-based violence. So all those forms are the ones that form the umbrella of gender-based violence.
I gather that given the lockup that we have globally experienced, especially because of the coronavirus pandemic, people tend to, of course, stay together for very long time and stuff like that. To what extent have you received reports that, for example, gender-based violence has increased as a result of that?
Schools have been closed for more than 3 months now. People have been working from their homes, and we have seen women who are even working in the informal sector also leaving their jobs. Of course, being fired from their jobs because people are fearing the transmission. And even those who are running small shops within their neighborhoods have now stopped working, and most of them are now at home so that they can take care of their families. And this is causing a lot of conflict in the homes. We have seen also men who have lost their jobs. So this new way of living with everybody at home. There are no jobs. Women's burden of care has been increased to take care of the children who are at home, to take care of the sick who are at home, those who are elderly. And of course, this brings tension in the families and a lot of arguments. And recently, the Ministry of Health, as they were announcing the number of cases, that one of the days they actually announced that the number of cases that have been reported in the country have gone up by 33%. And we've seen that kind of increase also with the refugee population, because we are getting more calls with many more women and young girls reporting either being sexually abused or intimate partner violence being reported, and a lot of verbal abuse in homes. I think people are agitated because of even lack of resources. This living together, we have seen young children, young girls, quite a number have reported being pregnant and they don't know what to do. So there's an increase in gender-based violence against women and children that has come with this COVID-19.
Eskinder, it's not that we forgot about you. You still remain very, very important. You know as well as I do that Africa is not, by any measure, a poor continent. Africa, on the contrary, is probably one of the most fortunate, one of the wealthiest continents on this planet Earth. As a matter of fact, there were some scholars who at one time looked at the Democratic Republic of Congo, given the kind of mineral wealth that it has, including strategic minerals. And this particular scholar concluded that you are talking about, in his words, not mine, a geological scandal. Any particular reason why a continent as rich as Africa continues to create conditions that cause or trigger refugee exodus?
Well, that's a loaded question, but let me try. As you say, I agree with you 100%. Africa is full of resources. In fact, Africa is now becoming a destination for some countries to come. But historically, if you look at, I think, in the 1960s, after a lot of African countries became independent, the structure that needs to be adjusted didn't adjust. So a lot of governments tried very much to replicate what the colonial powers used to do. That's why you see massive migration of Africa for the first time in history. We're talking about refugees now, but we have refugees going to Libya. In fact, some of them are in a very, very bad situation. The whole migration from the south to the north. So we have failed governments. You can see what happened in Somalia since 1991, after the air body. There's no really functioning government. Therefore, Somali refugees were forced to leave their country. Prior to that, there is no historical number or anything that Somalis becoming refugees outside, their country or living outside their country. So you can see it country by country. The DRC should not have a refugee, given the amount of resources and rich in minerals. But again, lack of government, failed government, lack of democracy, lack of transparency. Refugees are forced. Africa used to have, including in Uganda and Kenya, a lot of European living, not just only from a colonial past, but even after that. So Africa doesn't lack resources. I think what's a problem in Africa is lack of leadership, lack of democracy. And in some places, as you know, people who actually fought to get out of the colonial time became actually worse than the colonial forces that actually was running the country. So I think we have a lot of, leadership issue. With proper leadership, you will see that not many refugees want to leave. I just want to emphasize nobody that I know of, and I've been doing this work for many, many years, becomes refugees simply because they want to go to another country. Refugees are forced, a lot of this terrorist act that's going in Somalia, forcing refugees. Refugees are actually a victim of terrorism. So it is a leadership question. It's not a resource question. It is a management of resource question. And Africans in general, we failed, to really have a proper government that's focused on its people, focused on education, focused on freedom, focus and good administration. And that's really what happened. But I just want to go back, since Lucy was talking very eloquently about the challenges facing refugees in urban setting. Keep in mind there are about 320,000 refugees just in the Dadaab camp alone. And they have been there since 1991. Some of them are second-generation refugees. They have never been to Somalia. Their condition is, if I may refer it as refugee warehousing. There is nowhere they can go. There's no electricity. I've been there. I've been to Dadaab myself to visit. Not sufficient nutrition being provided, poor housing. And some places there is not even a housing, it's just a hut. A lot of single mom, a lot of unaccompanied minors. So the condition of refugees, especially in Africa, which is, the countries themselves, the host countries don't have enough resources for their own citizens, let alone refugees, is the challenge we have. In Eastern Sudan, we have refugees, Shaka, since 1967. This is second, third generation refugees. And if you have in Algeria, the Sahrawi refugees has been there since 1975. Imagine, So this is really a protracted situation where refugees have no way of getting out of that camp situation. And then they live in this horrible condition. If you have seen Dadaab, I believe The Guardian actually referred to Dadaab, not a good place for a human being, is what they said. So that's really the condition we are in. I know Lucy and her agencies are doing a great job for some of the refugees in Nairobi and Eastleigh area. But overall, when you look at the condition where these refugees are living day in, day out, it's just very, very challenging. And now we are adding COVID to it. There's no social distancing. There is no, good healthcare system. There is no education. There's no way to go. So that's really what the challenge for African refugees. And I think, I blame the governments and the leaders of those countries for creating this human catastrophe for refugees. It's getting worse. I mean, the number of refugees dying trying to cross to Europe is increasing, as you know. Shaka, we're going through Egypt, going to Libya. You have now over 40,000 asylum seeker Africans or more in Israel, and that's another destination. So refugees are desperate, and I think the government of Kenya and other governments are doing a good job in hosting Uganda and Rwanda. But there's desperate situation. They can't continue to live in refugee camp for 20 years, 27 years. If you remember the Burundian refugees in Tanzania, they were there for 27 years. And so this is a condition we are in. I think, UNHCR is trying their best, but I think the international community has to take into consideration, given the COVID and other issues, we need to have a solution for a humanitarian approach to this crisis. Because I think some countries are looking at refugees from a national security perspective rather than for a humanitarian perspective. And that's why you see the declining of refugee being accepted for refugee status. Therefore, they decided just to get out of the camp, go through sub-Saharan Africa, go to Libya, and then ended up being in the middle of a civil war, and they have no way to go. And some of them died going to Italy. The number of Eritreans who die trying to go to Italy is probably over 500, and the number is growing. So that's the condition we are in. And again, I'm not blaming any institution. I'm just simply saying lack of leadership is the key for this crisis. And unless we change the leadership, the situation will continue. And I would say, I don't have the data for you, Shaka, you probably know better than I do. This is the largest African migration in the history of Africa.
But when you talk about the Burundi refugees in Tanzania, if I remember correctly, though, didn't the Republic of Tanzania give them an option of becoming Tanzanian citizens?
Yeah. Yes, I think they did. Some of them came as a refugee here. I think the government of Tanzania did a great job. As you know, these are Burundians in Tanzania were survivors of the 1972 genocide that happened. And that's why they became refugees. They couldn't go. Some may have returned back, but I think some actually decided. So that's another way of really giving refugees a right to work, a right to go to school, a right to own a business. That's what's missing. In the 1951, when they decided to have the international treaty in terms of refugees, they actually said, refugees should have the right to travel, the right to work, the right to go to school, the right to own a business. Unfortunately, for over 60 years, what we have done is we keep refugees in refugee camps.
Eskinder, you mentioned something to do with what you characterize as refugee warehouse.
Yes.
Could you please walk us through what exactly you mean by that?
Yeah, refugee warehousing is a term USCRI, U.S. Committee for Refugee, used because we believe what happened for refugees in refugee camp is just warehousing them, giving them some ration, for food, but just keeping them for, without any hope or without any dignity. In 1951 Convention on Refugees, not a single word was included as refugee camp. Refugee camp is not part of the 1951 Convention or the 1967 Protocol. So what happened is the international community decided to have a refugee camp. A refugee camp, for example, the one in Eastern Sudan I mentioned, they've been there since 1967. Imagine, they may get some primary education. Since
1967?
Yes. they're still in the same refugee camp.
So they're basically permanent refugees.
They're permanent refugees. They have no future. They can't own a business. They can't go to school. So what kind of life are they living? So the question is, they're just being warehoused there and hoping one day something will happen, and nobody knows what that will happen unless we force them to go back to their country, assuming that their country is even willing to take them. The Sahrawi refugees, and nobody talks about them. They have been there. Yeah, West Side, 1975, Shaka. They have been there. You don't hear about them. Remember, I think the international community from time to time, we have this selective outrage. Some refugees are on the news all the time, which is a good thing to do, but you have also some forgotten refugees.
Some refugees are more refugees than others.
Unfortunately, that's the case. How many times did you hear about Sahrawi refugees? How many times do we hear refugees, Eritrean refugees in Sudan since 1967, 1968? That's part of the challenge we have.
If you said that, the Moroccan authorities will probably take you to the courts.
I know. We have tried. Yes.
Very interesting. Go ahead, please.
So again, if you go around, you will see that, the refugees just simply living in refugee camp is not an option. It's not the right thing to do. I actually characterize a human rights violation. Nobody has to be in prison. Refugee camps are, open prison to some extent. I have been in Dadaab. I have seen it. I'm sure Lucy probably seen it more than I did. But that's not the way a human being should live. There's nothing there. Of course, refugees are not just simply idle people. They try to start a business even in that refugee camp. They have no right to get out of the camp, to outside the camp without permission. So that's the kind of condition refugees are living. And now you add this COVID crisis, where there's no sanitation, no electricity, no medical care, no insufficient nutrition provision, poor housing condition. That's really what the life, if we don't call this refugee, I don't know, warehousing. If we don't call this warehousing, we might as well call it prison.
But Eskinder, how can you, for example, call an African a refugee in Africa?
So that's actually a very good question. As you know, that prior to 1950, we didn't have a single African refugees. Again, remember, the refugee issue is also part of what happened in terms of the demarcation of borders from one country to another country.
So you are going back to 1884, the Berlin Conference chaired by Chancellor Bismarck of Germany.
Exactly. So you can see that, for example, if you go to South Sudan, Yei, the second largest city in South Sudan, is about 10 hours bus to Kampala. Yeah. And then on the other side, if you go to Chokichoko and then the Sudan border, you see, the same people living in different countries. If you go to Chad and Sudan, there's the Zagawis and Darfur. They're also in Chad, but at the same time also in Sudan. So that's part of the border conflicts as contributing to this refugee crisis. That's why you have a lot of IDPs in Africa also, not just necessarily refugees. They are actually refugees in their own country because of their ethnicity or other conflicts. South Sudan is a classic example. We have now so many camps in South Sudan, in the Bantus and Malakal, all these places now. We are actually within South Sudan. South Sudanese are becoming refugees in their own country.
As a matter of fact, if I recall correctly, the number of what you call the internally displaced persons in southern Sudan and the number of Southern Sudanese refugees in the neighboring countries seems to be greater than that within the boundaries of Southern Sudan.
Yeah, within the boundaries of South Sudan, in Bentiu, in Juba, in Malakal, there are actually camps now for South Sudanese. And again, as you know, and I've been to South Sudan, I've been to Ye, I've been to Rumbek, I have seen it. Again, it's a lack of leadership. And South Sudan is a very rich country. In addition to that, they have oil. But at the same time, this lack of leadership, after 50 years of trying to have their own country, that now after independence, after becoming an independent country, South Sudanese are becoming refugees in their own country.
Lucy, from your vantage point, Lucy, you've listened to your fellow panelists, Eskinder. He's talking about, among other things, the leadership deficit. There is a distinguished scholar and a friend, Professor George Aipe, who has written many books and has actually said when it came to regaining political independence from the European powers, what Africa did was simply inherit the same colonial vehicle. That all it did was simply changing the drivers. When in fact, what is needed, what is required is to change the vehicle, not the drivers.
I think what Eskinder is saying is reflective of what we are seeing in the African states. We have leadership that is based on ethnicity. We have leadership that is kind of inherited, what we call dynasties. It is passed over from one family to the other. We
but
have also seen.
You keep talking about leadership. Is that really leadership, or are you talking about rulers here?
It depends on what angle we look at, but those are the leaders that are in the African states. And as you said, we are not changing the vehicles. We are only changing the drivers. But unfortunately, the drivers come from a lineage, from some of them from actually similar family backgrounds. And what the way they are providing leadership in their countries, it is from what they have inherited from their forefathers, and that's why we are not seeing much changes. What Eskinder also mentioned is that we have people who are hungry for power and resources. The leadership we are seeing is focusing on power and not focusing on developing the nations that they are leading.
I thank you too for being my guest, and I certainly look forward soon to hosting you live from the normal studios of the Voice of America.
Thank you, Shaka.
Thank you.
Welcome, sir. You're most welcome, sister. On that note, our distinguished guests are Lucy Kiama and Eskinder Negash. Thanks to our audience for tuning into Straight Talk Africa. In the meantime, get better, not bitter, and please, please remember to keep the African hopes alive.